I'm Kristen Roman, and I am the Captain of Community Outreach for the Madison Police Department in Madison, Wisconsin. Our program has emerged through years, really, of collaboration with mental health partners and other community partners to the current model that we have now, which I often describe as kind of a hybrid model with 3 layers, as we look at it, 3 layers of police response. The seed was planted really from the front lines with patrol response and a mental health crisis worker response. In Madison, that was really the seed for us. From there, we built out and included other participants at different levels of our organizations. So we have the frontline responders already partnering out of necessity to respond to these calls when they happen. The next layer then are the policies and the administrative, structural systems supports that really fall to supervisors and managers and in my department to commanders. So really, I think our success has been built through adding those layers of support so that the officers on the street are dealing with a system behind them that supports them. One of the unique things about our program is that it did not result from any windfall of a grant, any budget approved process. Instead, our program really was about taking a look at existing resources and finding ways to put them into the field and put them to work in more dedicated and I think useful ways to address these specific issues. For more than a decade, our program relied on officers and supervisors, and myself included, assigned to some other primary function, but doing this work sort of on the side. At the time then that our chief decided to really commit resources full-time to this work, we established a community outreach section. I was installed as the captain of that section, and all of the work around mental health and our response to people with mental illness then was structurally and organizationally now supported within a dedicated unit. So the work that all of our volunteers had been doing for years now became a primary full-time responsibility. Our collaboration in Madison involves a lot of coordination of responses and services. So typically how we go about that on a day-to-day basis is through collaborative meetings across disciplines. We've blended the 2 systems, criminal justice and mental health, and really have mobilized around some key issues and working together to try to improve our respective responses. So we collaborate at a couple of different levels. We have collaboration sort of at the policy or administrative level, which I'm heavily involved in, and then we have kind of a street level collaboration that involves the mental health officers, our patrol officers, and our liaisons working day to day when those calls arise with our partners in the community. So the collaboration includes meetings. But oftentimes what we'll do is if an issue arises, we'll sort of triage it in terms of where best to address it. Sometimes it has to do with an overall systems or policy concern or issue. And that's where I'll get involved in working with our partners in the mental health field to address those issues. We also can sometimes have issues that come up case by case with individuals, and we'll call together a team to kind of go through that particular incident or that issue that was born out of a specific individual, and we'll work together collaboratively to develop some sort of an agreed upon response plan for that individual in the community. Our mental health officers get involved in some of those response plans on a day-to-day basis. They're working collaboratively with case managers, with family members, oftentimes who initiate contact with these officers, and with hospital social workers and others to put in place some kind of response plan. clearly the time of a crisis is typically not the most ideal time to be thinking about what our response should be and what the most appropriate response is. So to have the relationships ahead of time, to have the conversations ahead of time when we are not in any sort of crisis situation is really key to making sure that when we do respond in a crisis, that we're doing that from a very informed place and from a place in which the relationships have already been established, and in many cases, our response has already been thought out. I think it's very important to have the written policies that support the practices in the field. Some sort of reference that guides officers through these calls, but also really articulates what our philosophy and expectations are around this particular type of service that we provide. Our policy was actually developed also through a collaboration with our mental health partners to help us develop a response and a protocol that best meets the needs of these individuals.